and then shut down for a bit. Thank you. All right, it's speech time, and I understand that Dr. Strauss is not here today, but we do have someone here that knows something about him. I believe that's going to be Keturah Beiler is up first. Is that right, Keturah Beiler? Come on up here and tell us what it's all about.
I'm Keturah Beiler, a nurse at the clinic, and Dr. Strauss very sadly couldn't be here, but he has remarks that he wanted us to pass on to all of you, so I'm just going to be reading that, and this message is from him. He says, "Dear friends, I'm home healing from a recent surgery, and while I expect to fully recover, it's serious enough to keep me apart from my clinic family on one of my most favorite days of the year. As I give thanks for the clinic's past and plan for its future, I look back at the very first clinic newsletter entry that I wrote in 2001 to see how my feelings have changed over the last 18 years. That essay was in response to a simple question put to me by Caroline Morton. Why did you choose to come to the clinic? My answer to that question is the same now as it was then. Children who need our help teach us something about ourselves and the world we live in. They teach us the meaning of suffering, which cannot be captured in the name of a gene or a chemical. They teach us the meaning of humility, that our progress, while measurable, is never enough. They teach us the meaning of hope, which is always to be found at the center of despair, but it demands sacrifice to keep it burning. And they teach us the meaning of love, which is what gives purpose to that sacrifice. On this very special day, the clinic's 30th anniversary auction, you will see pain, hope, sacrifice, and love stitched, burned, nailed, brushed, woven, baked, hammered, and etched into everything around you. I regret I cannot be present to share this day, but I'm with you in spirit and grateful for all the hopes and prayers sent my way." From Dr. Strauss.
Thank you, Keturah, and I believe next up is Donna Robinson.
Hello, I'm Donna. I've been at the clinic for about 24 years almost, and I'm just going to talk a little bit about 30 years of the clinic and 30 memories that I have of my time knowing of the clinic. I was familiar with the clinic from the very beginning as I was a staff nurse at the pediatric unit at Lancaster General. So some of these remarks actually go way back to then. So these are going to be quick bullet points of the 30 years. First memory. Taking the trash out to the end of the lane as a trash man wouldn't come down the lane. Dr. Morton actually mowing the grass himself. Dr. Morton enjoyed walking to the clinic. We had someone named Lisa Kratz come to the clinic to run our MSUD and GA1 carrier testing once a month. Now we run it daily. We collected urine samples on nearly every patient. We used to have skunk oil in the freezer. And every time you opened the freezer, you were reminded that it was there. I remember the 2000 to 2001 building edition with the clinic raising, shining our car headlights on the building to help the men finish getting a roof on because it was supposed to snow that night. A big snow. We never got a flake. I remember Rebecca's family's house fire. I remember getting this set of orders from Dr. Morton for these 3 patients with something called butyric aciduria type 1. I had never heard of it. We had these orders in the drawer at the hospital, and we never used them. We never did see those 3 patients for the first 5 to 10 years of the clinic. I remember admitting the first pre-symptomatic GA1 patients who remain uninjured to this day. I remember an MSUD patient who stayed at Lancaster General for 2 months. I remember driving to Belleville to collect samples and stopping at a local doctor's office to borrow his centrifuge. I remember admitting my first MSUD patient to Lancaster General as a new nurse practitioner, going on my first house call and committing a cultural faux pas by asking about her obvious pregnancy. I remember this guy called Eric Puffenberger who kept calling the clinic and eventually showed up here to work. I remember working with paper charts and the challenge of trying to find them. Also trying to determine which John Stoltzfus on Old Philadelphia Pike I was actually talking to. I remember our first MSUD liver transplant, our first Spinraza port infusion, my first clinic auction, and feeling the overwhelming support of the community. And sadly, I also remember our first patient death. I realized, having been at the clinic long enough, my babies now have their own babies, and they are taller than I am. I remember my first family day and realizing the uniqueness of the clinic's approach to keeping families current with the disorders that they live with. I remember Dr. Strauss coming to the clinic to do an independent study that was supposed to last 1 month while he was a med student, and he kept extending it. He created his clay model of the brain that many of you may remember. I remember such a thing called Morton time. We still have some people that follow Morton time. The sign on the door inside Katie's office that said, "You need to be this tall to be one of Katie's patients," just reminding everybody of her love for caring for our shorter patients. I remember the first 10K chip that was done. I remember Christmas dinner parties at the Morton's home, our first gene therapy patient in recent year, watching our staff grow from 15 to 17 dedicated employees. And lastly, in case you were counting, this is actually number 31, but meeting so many of you and your wonderful families and long-standing supporters of the clinic. Thank you.